Welcome to another cycle of Dirty Laundry Clean Confessions, a family podcast created for the next generation. Grandma Smarge can't wait to see what you'll become, Monk and Little Al. Live, pre-recorded from our family laundry room, with Smarge, Haas, and sometimes Otter, and always not the real guest. Here we hang it on the line with everyday ordinary people who are doing extraordinary things. In the room where famous people are loved, adored, and admired, however, not invited. Except for the great Willie Nelson, of course. Thanks for joining us in the laundry room while we fold through life's journeys. Here, we're keeping it real, washing through stains, and making colors a little bit brighter. Here we are.
It's a weird
What
opening.
was that? Yeah. Wow, you're awful energetic.
I know.
That sounds like caffeine or something.
Yeah, I think I had maybe a little bit too much caffeine at work today or something.
Yeah, maybe. I don't know.
I'm on
but
one.
That's okay. You seem happy.
I am. What a great
Here
day.
we are, Sud Buds.
Yeah, we're back. And we've also been wondering, too, for our Suds Buds listening in that have been following us for some time, feel free to email in or message us on Instagram and let us know what kind of content you want to hear next, because we're always looking for new guests and new topics.
As long as you're not famous. As we say, we love and adore the famous people here. However, they have to email in or call in. They just can't be on the podcast because we're talking to real people.
Yeah.
And we are recording in the lower level laundry.
Yeah. It's
this time.
The new Studio 2.0.
Yeah.
And
I'm
honestly,
liking
it's really nice.
It's a lot quieter, isn't it?
It's a lot quiet. Well, there's also no one here.
That's true.
And our executive
empty.
producers, Willie and Nelson, are very quiet tonight.
Yeah,
So
they're actually in the room with us.
yeah. So it's been good. So how's your laundry sitch, Smarge? What's life going on?
Actually, I'm a little behind on my laundry.
Oh no.
However, good news. I'm getting caught up on some family photos.
Oh yeah.
I went down a rabbit hole in the storage room the other day.
Oh no.
And yeah. But coming out of that, I have like another album put together of fun family trips that we took together when my girls were 18 and younger.
Mm-hmm.
So it was fun. And talk about a trip down memory lane.
Oh, I bet you sat in there for hours.
Giggled, laughed,
Yeah.
cried.
Cried
Yeah,
a
it
little
was
bit.
great. So, and there was this one particular one that came to mind. And is when my youngest was 8 years old. And we were in Cabo, Mexico, and we were there with our dentist and his son and his daughter. The dentist, we called him Tooth. He was a family friend.
Tooth? His name was Tooth.
And everybody called him Tooth.
Okay.
Yeah. His first name was Tom, so maybe Tom came from Tooth. I don't know. And he's a dentist. It made sense to me.
You gotta have a cool nickname, I guess.
And he had been my dentist since I think the first time I saw him I was 20 years old.
Yeah.
So he was a family dentist. Anyway, we were down in Cabo, and Poppy and Tooth were going to go play some golf. So I took the 6 kids to the beach, and they were going to meet us there.
Mm-hmm.
And the youngest we're down there, and they're having a great time. And the youngest just comes tearing out of the water, screaming. And I see that she has a jellyfish wrapped around her arm.
Oh, God.
So, it's stinging her. She doesn't know what's going on. I'm trying to get it off of her. Her 3 older sisters are saying, "I'll pee on you, don't worry," which is only making her scream louder. We're on a public beach.
Right.
There's restaurants. There's,
That's the last thing she wants to hear.
Oh, yeah. That only freaked her out more. And I looked at Tooth's son, and I said, "Oh, go get your father. He's a doctor."
Right.
And he shot right back at me. He's 11 at this point. And he goes, "He's a dentist. He's not a doctor."
Oh, my God.
And I went, "No, he's had medical school."
Right.
And he even looked right back at me and went, "Kinda." I'm like, "Would you go get your father, please?"
Oh, no. Poor kid. He had no idea.
Too. Kind of a funny family story. And, youngest ended up being okay. That actually is Malcolm's mom now.
Mm-hmm.
And she ended up being just fine, and her sisters did not pee on her. I did protect her from that.
Okay, good.
And the locals really helped her. The locals helped her with papaya skin and vinegar.
Oh, wow. Okay.
Which really helps. So
you hear that, folks? That's the key.
That's the key for jellyfish stings. Yeah.
Yeah. Because I did always think it was pee.
Well, if you think about it, pee, I'm assuming, is acidic, and
Right.
vinegar is like, so it must have the same type of thing. But
Right.
she was all for the vinegar being poured on her.
Yeah,
that was
I
okay.
would opt for that as well. Vinegar and papaya.
But
Okay.
it brought me this whole story. I was sitting in the laundry room, and I've always wanted a dentist on the podcast, but then it started making me think about why is it different? Like, why do people think a dentist, like,
Right.
and why isn't dentistry with healthcare? Just like, why isn't mental health with healthcare? Why isn't it all freaking together? I don't get it.
Why is it all separate?
But even I had this son of a dentist tell him, I'm like, no, I know he went to medical school.
Oh,
What
yeah.
do you mean? Kind of. No,
Yeah.
I don't think so.
Probably 8 full years
So-
of
My confession is I would like to speak to a dentist, Toss, about why this is like this, because I think it's just like mental health. Like, why isn't it grouped together?
right. And vision too. Why is
And I
vision
do want to know if they go to medical school. I assume they did.
Well, you know what, Smarge? You
What,
are
Haas?
in luck.
Did you come through?
I came through because I knew you were.
I've
gonna
been
have
wanting
this
to have,
question.
but I've also been wanting to have a dentist. I told you this.
I know, you've
so,
been
yeah.
you've been bombarding me to get a dentist
Yeah.
on here, and I may have found you the best dentist in Denver. I may be a bit biased, but
Okay.
he's also my dentist. He's
oh,
great.
okay.
But
And-
anyway, we have Dr. Kev on. Thank you so much
Hey.
for
Oh my
joining
gosh,
us.
it's so good to be here. You
I'm
too?
so glad you're here. I mean, I have a ton of questions, and we're doing this for the next generation, and I just hope in 25 or 30 years it might be a little different, or I don't know. But is there a division like what I witnessed with Tooth's son that I had to explain to him at 11? Your father did go to medical school, like real medical school.
Pretty close. Pretty close. It's definitely focused on teeth.
Well, of course, but it's
But we are dentists, so we are obsessed with teeth.
yeah.
Right.
Well, that's
you
that's
should.
what
The
comes with
business.
it. Yeah.
Yeah.
Mm-hmm.
But you did go. I mean, you went to what, 8 years of medical school?
4 years college,
Okay.
4 years dental school.
Okay. Right.
Medical school and dental school do resemble themselves. They're very similar
Yeah.
in lecture style and clinical style, but different in a lot of ways.
Well, yeah, I can imagine.
And then medical, since medicine, you study the whole body except for teeth.
You're kidding,
I mean, not I am
because that's your area.
I'm kidding a little bit, but
But
they
not
do get
really.
very brief education
Okay.
on dental things because they know
right.
we dentists will take care of it.
Right.
So go see your dentist is what the doctor says.
Right. Okay.
Don't you think that it is really odd that they're not,
I like what you're
connected?
I like where you're going with that, Smarge. I was actually just talking about it today in the dental office with a patient.
Oh, really?
It does get talked about fairly frequently why dentistry and medicine would be so segregated. It's a lot of it's a historical thing. Also because of like the issues patients present with. But it is really interesting that dental insurance and medical insurance are entirely different.
It's
so
crazy.
It
annoying.
really doesn't make any like logical sense. But
No.
I think the biggest reason why it got separated is probably because of insurance and financial billing, like realities, and then also probably the reality that teeth issues are so common that they need to be dealt with on such a regular basis that, and with the specialization within medicine, you focus on kind of one area.
Right. Okay.
But taking care of teeth, there's a lot of nuance to it. So in order to become a dentist, you really need to learn the technical and clinical skills of dentistry, which puts you on a different plane than medicine because the skills are entirely different. I mean,
That's true.
we are fix-it type of people. And we do need to reconstruct and rebuild
Right.
teeth. And because of that reality, our work just is a lot different than medicine.
Right.
And you see these people typically 2 times a year, as opposed to a doctor may not see their patient
You're supposed to see them
for
once a year.
years. I mean,
But
but
I
a lot of
guess
men I know don't go to
Yeah.
the doctor for years.
But there is a direct, I mean, they have proof of this, right? About the connection between your dental hygiene and heart issues, correct? So there's another reason why I don't understand that it
This
isn't
is-
all
well, it's all
together.
connected.
Because
yeah.
it's been proven, correct? That's not just a,
It is funny, even the fact that we have to have this conversation as if it's potentially not the case.
Right.
It's
right,
so
right,
obviously
yeah.
true that
right.
the mouth is so intimately connected with the rest of the body. But the reality is the fact that your gums and the blood supply is so richly connected to the entire cardiovascular system, especially the heart, which of course is the center. Anything that gets in through the gums gets in through the blood supply and in through the heart. So there's problems with bacteremia and bacteria that corrose, go throughout the whole bloodstream.
And it is the same type of plaque, right, that builds up on your teeth that can build in your arteries.
Can be, yeah.
I mean, it can be. Wow.
Yeah.
Well, it's just crazy that most people don't understand that correlation, though. I feel like that's not common knowledge, unfortunately.
Right.
Which is kind of sad.
Now there's, a lot of people talk about nerves and how those are connected to the rest of the body, energy, acupuncture points and how each tooth is innervated and that connects with different parts of the body. And then fascia and fascial.
Oh, the fascial system. Yeah. Okay. Now, well, that leads me to one of my next questions. So your practice is based on a holistic practice. What does that mean exactly? Because you don't see it with every dentist.
Holistic is an interesting word. It's been used throughout a lot of different realms of study, if you will. But in medicine, dentistry, it is interesting because holistic just means whole. So it's a whole body approach.
Right.
Which to me seems like an obvious approach.
Right.
But there's been different paradigms throughout medicine and dentistry of what practitioners and providers focus on as far as how they problem solve and address patients' symptoms, disease, and their issues. And the emergence of a holistic approach, to me, it seems obvious how we should approach the human body. But because of the history of just kind of what needed to be done in order to keep problems away, it wasn't necessarily a pretty history for dentistry or for medicine. But dentistry has a really tough, to me, it's a tough history because if you asked me to practice dentistry 30 years ago or 50 years ago or more, I just wouldn't do it.
No.
Not comfortable for the patients, not really addressing problems, not
right. You're just
people with
putting
health. You're
Band-Aids on
putting out
issues
fires.
Yeah.
And I think medicine and dentistry for a lot of years was putting out fires.
Right.
And then now we actually are in an era of dentistry where we can actually address big picture problems on a whole body level and really impact people's health in a positive way.
Yeah. Just surprising that there's not more dentists that have that more holistic approach, You'd think that would be, your mouth is the source of most of the things that are going to go wrong in your body are going to go right. If you treat your mouth properly, then it should help the rest of your overall health. It's just kind of crazy to think that a lot of other dentists don't necessarily think that way or don't necessarily take the steps towards educating their patients in that way. I mean, it's just kind of surprising, but I'm glad that you've took that approach.
Yeah, and it's part of the conversation is really interesting because there's some mainstream established viewpoints that oppose holistic dentistry.
Oh wow, yeah.
And to me, that seems concerning and alarming.
Yeah, that's terrifying.
Yeah, it's a little bit disconcerting, and part of it is probably protecting their established workflows and the way they do things, and kind of like I described paradigms. When you're in a paradigm and you believe a certain set of ideals and practices and way of doing things, to leave that behind and do a different way of doing it, it's very challenging for their perspective and the way they see things and the way they do things on a day-to-day.
Right.
So ultimately to do what I'm trying to do, it takes a lot of effort, time, financial investment.
Yeah.
And it's very challenging.
Different tools, and yet you need more, staff. Complex. And educated staff and educate your patients.
There's lasers and there's ozone and there's biology and there's question marks and unknowns, and it's not cut and dry. There's a lot of nuance, and that makes the patient conversations more elaborate.
Oh, yeah.
And involved, and all of a sudden you're in an hour-and-a-half consult and you haven't made any money. All you want to do is drill 5 crowns and go home.
Yeah. Well, I'm sure, a lot of these dentists that have been doing this for so many years, I can imagine that it would be really difficult for them to stop their everyday practice and learn a whole new way of doing things and learn new approaches. I mean, I can understand to some extent, especially some of these older dentists maybe that have been doing this for years and years.
Yeah.
They don't necessarily want to know the new technology to use or some of these new practices that might be more beneficial to the patients. Like we talk about root canals, all the time, and that's just been a normal type of protocol. But I think, I don't know if you want to speak to root canals, but I know that
I thought we were saving that for later.
Yeah.
It's just like, we're just getting warmed up.
I know.
Boss, take it
I think
easy on
I'm
me.
jumping ahead. But it's just crazy. I think that the whole dental community is making a turn, and I'm glad that you're kind of on the forefront of that, at least in the Denver area. So that's really exciting.
You definitely are speaking to an interesting thing, because I do think it's, and I've talked to another dentist that has this issue. They're so busy with classic dentistry that they have a hard time freeing up enough time to learn everything, and then you have to do the hard work of implementing it on a clinical level,
and have the staff trained,
and
have
the equipment, have the time to train the staff. You've got whole new processes that are a lot more complex than they previously were.
Right.
You're sure impacting health on a better level, but like you're spending evenings and weekends at the office doing
a lot
this,
of
that,
research.
and the other.
Resources, time.
But I was thinking about it even just the other day, how grateful I am that while I had time still, I put in the continuing education on my weekends, spent effort on building out clinical protocols and
Well, that's nice to hear
training
that.
programs.
Like you spent your time wisely, and you are feeling really good about that. That's way better than looking back on why didn't I?
Right.
So good for you.
And I feel lucky too, because I've been trained by like some of the best in the nation.
You really,
And that I feel super grateful for. And then I feel like I got a little bit lucky, because the continuing education programs that I chose to go to probably are some of the highest yield and some of the better training programs in the country.
Yeah.
Nice.
Oh, that's awesome.
And now that I don't have as much time to keep going,
Right.
once a month, now it's like,
But great. What great reward, that you're looking back at what you did and you spent your time great.
and it's very exciting to be treating people on a day-to-day and seeing the results, seeing people heal from surgery in a really productive way, seeing positive outcomes with less discomfort, seeing things succeed and not fail. And then seeing patients love it. I mean, you look at the Google reviews at our office are just people ranting and raving.
They really are. We were looking at your website earlier.
Yeah, we were, and it's just amazing.
You just wouldn't guess that people would love going to the dentist, but
Well,
they do.
It's
Well,
crazy.
What I felt was, oh my gosh, this is great, because maybe it's reinventing dentistry in a way that will get us to better dental health care. Because
Eventually,
what the people were saying, what the patients were saying, were all great. I mean, and some of the things I was reading about, like, I didn't even know a dentist could help you with, to be honest.
Yeah.
You know what I mean?
For real.
So I was like, that's nice.
It's very true.
And I really did want to take a step back, because we kind of did dive in. We got a little excited. But I kind of wanted to learn from you how you even got into dentistry and how you found that passion. And, I mean, at what age maybe were you at where you decided, you know what, I think I want to look into dentistry?
Always a great question. I get this one a good amount, and it's always a fun one. Because I and to kind of tie it into the dentistry I'm doing now, I never would have guessed I could do or would do. And it's like impacting people on like a whole function, chewing, like sure, but from rebuilding to all of a sudden now we're doing
to sleeping better.
Breathing.
Just sleeping better.
Oh my gosh.
How many Americans say
nasal
they don't
breathing and
sleep? I mean, sleeping is it's a necessity,
It's
and
huge.
a lot of us don't get enough.
It's wild.
It's amazing.
It's wild. Yeah, so at a very early age, I do recall finding fascination with the human body. First, it was the eyeball and just being like marveling at the wonders of the human eye and how it works. And that was kind of like one of my earliest like childhood memories of
How old were you?
I must have been like,
That's-
I must have been 8 or 12,
Okay.
maybe 12. I might have been
Okay.
12.
Oh, wow. Okay.
This might have been like 10 or 12.
Young.
Yeah.
Yeah.
Pretty young, pretty young. And then I watched my mother go through a few orthopedic surgeries with her knees. And she encouraged me to think about medicine as a form of profession.
Okay.
And my family had and then I was kind of tossing around a couple options. Of course, you think about maybe I should do what my dad did, maybe I
Right.
should do what my mom did.
So what did your parents do? If you want to share.
My dad was an electrical engineer,
Okay.
and then my mom was a dental hygienist.
Okay.
There it is.
So we
Yep.
see where the seed
You
came.
see where this is going?
Yes. So we see the seed has been planted.
But I originally thought, like, the dentistry it seems weird, working people's mouths and with the gross and this and that, saliva splattering all over the place.
Even stranger than the eye. The human eyeball.
I was gonna say, I
Yeah,
don't
it's-
know.
I
Seems
don't know.
cleaner. Some
Does
reason the
it?
human
Okay.
eye or
I
the
don't
knee or
know.
something seems cleaner.
The human
So-
eyes could freak me out, but yeah, okay.
And that
This
was
is why I'm not a doctor.
I was a sports guy, so I
Right,
was like, okay, like orthopedic surgery, like I built Legos as a kid. I can fix things, like work with my hands, So I really became wanting to do something where I work with my hands and my mind,
Okay.
where
Yeah.
I'm not doing carpentry or building or I'm doing something that incorporates like a really deep level of understanding
Right.
and like knowledge pursuit. So I went to college really prepping for pre-med and medicine. And then of course, at some point, my older sibling, my sister, she graduated from electrical engineering, following dad's
Followed
footsteps.
dad, and then you followed mom. How adorable.
It wasn't the intention originally, but yes.
Okay.
But she started her first.
I mean, as a mom, you can just see where,
Oh, yeah.
and a grandpa. I'm
yeah,
just
yeah,
like,
yeah.
this is just great.
I'm a mama's boy at heart, so it is what it is. But yeah, she said at some point, like, she was getting her first job working 40 hours a week, and it was actually like 48, 50
Right.
hours, and she was like, this blows, like working this much. And Kevin, didn't you think about it that medical doctors work like 80 hours a week? And I was like, oh yeah, that doesn't sound that good.
That would be awful.
And I was like, work-life balance and owning your own business and this and that. And I was like, all right, flip. Like,
So you always knew you wanted to own your own practice as well.
I think I
you
always
had
loved
that,
working
yeah.
in a small clinic setting.
Okay.
And my mom was a hygienist, I grew up hanging out in the dental office on Saturdays. So once I started dental school, I always knew my day will come. I want to start my own practice.
Okay.
Right.
Okay.
I think the interesting part is when I really got established in Denver, started working in a few different offices, I actually was thinking I should really do a startup. Gives me the opportunity to build it how I want, have it be more of a representation of me
Of you, yeah.
and not like take over someone's old stuff that just has to get all refreshed anyway.
Yeah.
Nice.
And then I almost bought someone's practice, but didn't. And then boom, year and a half later, got a chance to get my own practice started. So
Yeah.
That
been
is
a-
awesome.
been a really fun road. And I definitely feel very fortunate to have made the decision to do a startup because you get the opportunity between the branding, the whole clinic.
How do you find
how it-
patience? That seems like
It's
scary.
not-
Is that
it's
the
scary.
scariest part?
Yeah.
Because
Yeah.
I get it when you buy a practice, right? You're buying the patients, aren't you?
Yeah, you're buying the cash flow.
Good for you, going
But
out
yeah.
on a limb and like
Yeah.
following what you knew was right for you.
Well, and you really did get to make it your own. Like, I've been in your office a few times, and it is lovely. And your branding is very nice. Your website is beautiful. It's really cool that you got to kind of make it your own.
Yeah.
So that's awesome.
Yeah. It's been really special.
Yeah.
It's been really fun. I feel blessed with the people that have come alongside me to help me with the mission because I'm a very passionate person. It's certainly taken a lot of investment to make this happen.
Yeah, I bet.
Poured my heart and soul into it, and to see a team come around me and make it all work, it's really, really something. So
That's
awesome.
amazing. That's amazing. I love the story.
And you started this practice now, how long ago?
So it's been 2 years and a month.
2 years. Congrats.
Yeah, thank you.
That's great.
Thank you.
And it seems like it's booming. I mean, is it almost too much?
We're almost to the point of it being too busy. So, yeah,
Which is
it's
great in a way, because
turning
that means
turning
like
the point.
people
Yeah.
are really opening up to different types of medical treatments,
Yeah.
with everything that you offer.
Mm-hmm.
So that's really neat.
Well, it is cool because you do offer so many different types of treatments. We were noticing that you have some type of like airway dentistry on your website.
Yeah,
Can
do you
you
want to, I don't
speak
know what
to
that is.
to
I don't
some
even know
degree?
what that is.
Yeah, this is I think my first fascinations with dentistry were rebuilding things kind of focused and surgical work.
Mm-hmm.
And then it turned into more of a holistic style of doing things. And so when I did my first lecture on airway dentistry, two things occurred to me. One is the fact that all this talk of breathing and sleep just fits perfectly with holistic dentistry.
Mm-hmm.
Like, how could you even have holistic dentistry without addressing breathing and sleep?
Right.
It's
Because it's
just
kind of
right up-
going through your mouth and that whole area that you are working on.
very true.
And it affects your whole state of mind. If you can't breathe or sleep properly, you're going to be sick and sad and depressed, and then that affects your oral health and
You
then
hear
your
that,
overall
Malcolm
health.
and little
it's,
Al? Get your sleep.
Mhm.
it's just all related.
important.
So yeah.
It's got to be a priority. It's when your body heals. It's when your mind gets to rest.
Mm-hmm.
I mean,
It's really
you got to get your
important.
sleep in.
Yep.
So
Yep.
airway literally means what it says. And what do you do to make
Yeah,
an airway
so-
better?
So-
What does one do?
Two things with the education course I was in then is one, of course, airway dentistry fits perfectly with holistic dentistry. And then two, I have all these issues. So
Right.
when I saw the symptom list of like upper airway resistance syndrome and what people feel and how they experience it and the symptoms they have, I was like, check, 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 check. I've dealt
Wow.
with all of these things.
Okay.
Yeah.
And then I started seeing pictures of the types of patients and the narrow arches and the deviated septums. So it became very apparent to me that I needed to be evaluated,
Mm-hmm.
and I potentially could be a candidate for this like style of treatment, which I didn't really investigate until I took my first CBCT on myself. So 3D X-ray, took a big scan, looked at my sinuses, and my left maxillary sinus was completely full of mucus.
Yeah.
And I was like all stuffed up, big
Wow.
deviated septum to the left.
Were you
narrow
feeling
arch.
this necessarily?
No,
Well, you were probably just
So it
so
was just
used to
there.
it.
I had never
So
noticed.
maybe
I
you were
mean,
having symptoms, but they weren't your typical, like, oh, I feel like I can't blow my nose, or I feel like it's my sinuses. You weren't having the typical. You were probably having other.
Yep. And it occurred to me later that I've never been able to blow my nose through my left nostril.
Wow, really?
Because at some point after expansion, I was able to.
Right.
And that
Whoa.
feeling of being able to clear the left side.
What was I
Felt
talking to you
amazing.
about, Haas? Like, I'm having a left side problem. Remember I was
Yeah.
talking to you about. But anyway,
Yeah.
yeah. So I'm assuming you must have had headaches or feeling lethargic or
I
something.
definitely had
I mean,
all
how
of
do
the-
you
Yeah. Yeah, there was.
carry around something? Because mucus is left over. It should be left from your body. It shouldn't stay in your body.
Mhm. Yeah, and some of it's the nasal breathing impact, right? You can't get enough air through the nose.
Oh.
So you feel it when you exercise because you end up
Mm-hmm.
mouth breathing right away. You already tend towards mouth breathing when you chew foods, or when you're sitting watching TV, you're tending towards mouth breathing.
Mm-hmm.
You look at my childhood photos, it's just mouth breathing, mouth breathing.
Oh, really? So this
Oh,
is
wow,
something that
really?
you were experiencing throughout your life, not just in young adulthood.
From the like young age of 2.
Oh
Wow.
my gosh.
Oh my gosh.
So-
That's nuts.
Do you have toddlers? Do you have young, or is that a pediatric dentist? Like, is there a difference? What? Yeah.
There's a difference, but yeah, I do see children in the practice,
Mm-hmm.
especially with the intention of helping them with their airways.
Because to be able to identify it before, how old were you when you figured it out? Do you mind me asking you?
I was 31.
You don't even look like you're 31, but okay, I'll believe you. Okay, I'll believe you. So I'm a little shocked
That's
by it. I'm a
crazy.
little taken back. But anyway, okay. So
At 31 years old, you realized
realized, and then you looked at your picture and you're like, oh my gosh, I've been suffering for this. So if you can help other people identify this when they're younger,
right? Yeah.
God, I wonder how many
Yes.
people are prescribed for stupid crap, and it all has to do with.
I mean, the biggest prescription right now is Adderall for ADHD. I, of course, had ADHD for most of my life.
Right.
You said you had it.
Yeah, just not diagnosed
Oh, okay.
for a long time, and I just coped. You learn how to like deal with it, but I was you're mentally fatigued more than you should be, and you're just kind of like 20% less than what you should be.
What? And you feel it in a way, don't you? It's like
You
a
feel it, but
foggy, or it's like
you're
a
otherwise
little,
healthy. You go to the medical
Right.
doctor, they're like, "Yep, physical exam, boom, 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 boom."
Good to go. Right.
You're like 100% from our standpoint.
and you're like, no, I don't quite feel it.
Yeah. But it was
Also, a hallmark of holistic dentistry is we believe everyone deserves to get to 100%, and we find the nuance of where unhealthy is taking place.
right.
How is that? What do you mean, the nuance of where?
Like, I mean, same for airway, right? Like when I went into the sleep physician to get tested for sleep apnea, I knew I had some problem with my nasal breathing. I knew it was impacting my sleep.
Right.
When I got tested, it came back almost exactly how I kind of thought it might. But the in-lab testing essentially suggested I had an apnea-hypopnea index of, I think it was 3.3. So I'm having 3.3 like disturbances per hour. But then during REM sleep, I was shooting up to like 9.8.
So you're having a lot more disturbances.
So
The deeper you slept.
in REM sleep, when your body goes into paralysis, all your soft tissues relax, your airway closes off, and you get more disturbances in your oxygen levels.
Right.
And REM sleep is, of course, when your brain gets refreshed. So I was presenting with mental fog and cognitive lack of cognitive fatigued
I can see
and
that.
ADHD kind of symptoms because of the lack of REM sleep.
Right. Because you kept getting disturbed. Yeah. Wow.
And the sleep physician's office then ultimately said, 3.3 on average falls underneath a diagnostic limit for insurance reimbursement
geez.
or the qualifying factor for mild sleep apnea. So
wow.
I didn't meet.
So
I
is
don't
it still
meet the
considered apnea? What
diagnostic.
you were going through is
It's an apneic
what Smarge calls it is
episode.
sleep apnea. Because Poppy has that from time to time.
Yeah.
Give it a
Yeah.
little whap.
Oh,
Yeah.
gotcha,
Yes,
gotcha.
sleep
I haven't heard
sleep
that one.
apnea. Yeah, I just
good.
whap him a couple times and he seems to roll over. But
No,
that is,
we need to get him in for a sleep.
yeah.
treatment.
I have a candidate for you.
Yeah.
Oh, we're here to
To
help.
see if it's, and sometimes
Very,
it's
very
just the
common.
structure. It ends up just being your facial structure, or
Yeah. So, so just to tie up the last point, I think it's interesting because, like, I'm offering people the opportunity to learn where they're at relative to the most ideal health we could possibly imagine for them.
Right.
okay,
I fell into a category with sleep and breathing where the sleep physician ultimately said, like, you clearly have problems. All your symptoms match up with what you're describing and what we see on the laboratory results.
okay,
Your REM sleep is absolutely disturbed. You're kind of in a category of mild sleep apnea because of the disturbance in REM sleep, but you don't qualify for insurance reimbursement or a diagnostic. You don't fall within the diagnostic category of mild sleep apnea because of the testing. So here they're saying I have an issue, but they have no treatment
okay.
and they have no next steps for me, right?
Right. And that's where your practice and what you've built comes in. So
Yeah.
Yeah, that's where all of us
here's something
airway
that
dentists around the country, that's what we're here
just occurred to me. Do you believe, and I just thought of this, maybe it's been discussed, I don't know. Do you believe that some people are diagnosed with depression and are put on antidepressants because when they do go to their doctor, they do complain about these things, and it actually could be getting more air to their brain when they're sleeping, and more REM sleep would, I don't know if it would solve it, but I'm just wondering now how many people are misdiagnosed, I guess, is what
Oh, yeah.
I'm thinking
I'm
a
sure
with
great-
a lot.
depression, because you can't not be depressed if you're not getting, I don't know how you could not be depressed if you're not getting enough sleep.
Yeah. Oh,
It's a great-
definitely.
It's a great point. It's a great question. And I love the question. It's part of what my philosophy is in the practice, is giving people the opportunity to explore what ideal health looks like from the dental perspective, knowing the huge impact we can have on a person's health. And you're exactly right, because anytime a person is fatigued or drained or challenged on a biological level, they're going to have harder time coping with
Yeah.
life and the challenges and the stresses of life.
Yeah,
And it
your
could be
coping
their sleep. It
mechanisms
could
are-
be the
yeah.
toxic root canal that's infecting their sinus.
Mm-hmm.
You know, it could be all sorts of things.
And that's especially like in kiddos too, because I think you just assume when kiddos can't focus or when when they're fidgety and they have trouble paying attention, you just we've come to it as a society to immediately assume, oh, it's probably ADHD, ADD,
Yeah.
and we'll just prescribe them with medication. That's going to fix it, and
But
that's
could it be
usually
something else.
not. That should not be our answer. I feel like as a society is to just throw medication down these kids' throats. We should be looking at the bigger picture and what's really going on. And maybe they aren't sleeping very well. Maybe they're not breathing very well.
Is an option. It's a great
It
option.
is. It definitely
However,
is. And
like
sometimes
what-
that is the answer. But
I'm going to call you Kaptain Kev at this point. What Kaptain Kev is offering
Captain Kev.
is like offering a whole nother world almost
Yeah.
to help get through this. Like
And you can really
like
get
a whole
down
nother
to
way to make yourself healthy.
the real issues, as opposed to just assuming that.
Yeah, just another option. And yeah.
Yeah.
And like mental health, a whole nother podcast, but that should be wrapped in with your health as well. Like I think it should all be the same thing because isn't that when we all feel the best? When our mental health and our body, I mean, no one's going to be going through a toothache and thinking they're on top of the world. They're not, It takes away from it. So I think bringing all that together and the holistic part, it makes me wonder about how many people are misdiagnosed.
You both are getting at exactly what I think a lot of us believe the next paradigm of dentistry and medicine looks like. It's both getting at the root cause.
Root.
You got it.
Got that one. Ba, 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 boom.
The amount of times I just, it's weekly. It's weekly.
I bet it's daily. Come on, be honest. It's
It's
probably
pretty close.
daily. Yeah.
It's
Pretty
close.
sure that's on your
Do you
website.
say anything at 2:30? Hey, it's 2:30.
Yeah.
Nothing. Yeah.
Dentist's favorite time.
Classic jokes. I got plenty of them. So. But yeah, the next paradigm within dentistry and medicine is probably a root cause model where we're actually looking for the root cause of the problem, as well as an integrated model where dentistry talks to medicine, medicine talks to dentistry, and more of your health providers understand the whole
That was
body
my next question.
as they do their part.
As it is right now, dentistry really doesn't talk to the medical part as much, and the medical really doesn't talk to dentistry. You guys aren't right in this. You're not in a kumbaya circle, are you?
You wish it was, but
Okay.
it's not. Sometimes it can be that beautiful, but most healthcare providers are overworked, don't have enough time to see their patients, especially in medicine, where the average
More
exam
so,
time
right,
is like
yeah.
10 minutes, 15
Yeah.
minutes.
Yeah.
And they're like,
Thank you,
lining up
insurance
patient after
companies.
patient. Yep. I even think about how many patients I can see as one provider on a day-to-day, and it's not that many, especially if I'm going to spend an hour in a consult.
Well, you're also trying to diagnose. I mean, diagnosing doesn't happen in 10
I could have
minutes.
a full-time job just diagnosing. I could have a full-time job just doing treatment. I could have a full-time job being business owner.
Yeah.
So what you're saying is, because I was like monk and little owl, like I hope your dentistry is in a whole different realm. Is that kind of what you're talking about? So the future is that somehow that combination to where a patient comes with a problem and your team is working on, could it be, here's the root cause for this area, and then you have the medical team, could it be this root cause? So you're working with them. Is that what
Correct.
you're saying?
Correct. So for our airway patients who come to us for airway dentistry and sleeping breathing problems, we always tell them we will always help collaborate and coordinate care between a sleep physician's office, an ENT's office,
Okay.
a massage therapist, a chiropractor,
Yeah. Whatever they need.
an osteopath,
It's so neat.
Nice.
a general physician, like whatever they need. We're here to help and help with the thing. I do think the ADHD and Adderall is a good example too of the previous model of medicine, which is of course pharmaceutical based, where you describe a condition like ADHD. It clearly presents in similar ways across populations. It certainly is an issue and a problem that people deal with. You have a pharmaceutical that helps treat the symptoms and help the person cope and deal with the issues. It all works, reasonably well, but that's the medical model, right? You don't have a way of finding out what the root cause of the ADHD is. You're doing symptom management.
Right.
Right. I see what you're saying. So you're just, and that is,
and
it's like, seems like the 80s, 90s way of doing medicine was like, oh, you have the symptom, we will give you this drug.
And
but
if
then
that
you never
drug
find
helps,
out, then you just keep on it.
It's usually drug, surgery,
or say that
therapy.
drug doesn't help as much. You keep taking that drug and then we'll give you another drug.
give you
and then
more.
those 2 drugs will really help probably.
right, or we'll give you a higher dosage.
But you never find out what started the whole thing.
right.
And the worst outcomes is probably for some people ends up being polypharmacy, where you see the 68-year-old woman who's on 14 medications, and some of the medications are only on board to treat the symptoms of a previous medication.
Oh God.
And
That's
that,
what,
to me,
yeah.
is one of the big
So what do you call that?
failures.
Medication treating medication symptoms. What do you call that? Does it have a name? It should.
We definitely call polypharmacy the
Oh, okay.
approach
is
to prescribing.
this means one more for another one.
Medicine.
Yeah.
Oh
Yeah.
God. That's awful.
But it gets pretty concerning sometimes.
Yeah.
Well, what a great alternative. I mean, really.
Yeah, and that's the goal, clean things up from a dentistry standpoint so that we know that the mouth is rid of infections and bad bacteria, inflammation, and toxins.
Yeah.
And if we know that the mouth is clean and that it functions well, that you can chew foods like salad greens and nuts and everything, that you have your smile that you feel comfortable with in social situations.
Yeah,
You're not
self-confidence.
staying
Yeah.
home from like a friend event or dinner or whatever.
So do you have a patient that comes to mind right away? If we were to ask you, like, did you change, like, you knew you changed their life? Like, they were just at home because, they were embarrassed. I mean, it's like people that experience it with weight or with acne or... So I see like somebody with bad teeth just staying home.
Mm-hmm.
Do you have someone that comes to mind? That
At this point, I probably have like a couple hundred people. That
oh
come
my
to
God,
mind.
that's
Yeah.
great. That's awesome.
So I feel
well, there you go.
I do. I go to work every day loving what I do. I tell patients every day like somehow I love my job, and
So
Very
awesome.
fortunate. I'm
Feel-
very
You
fortunate.
should feel very blessed. That's awesome.
and then I get to do it in a cool environment with great coffee and great music.
Yeah.
What
There
more
you
could you
go.
want in life?
What more could you
So
want?
and then
With
and then
great people.
so when you have a patient, they come to you and you're gonna like they confide in you and they say, I really don't go out anymore. I don't want people to take my picture. I don't,
Mm-hmm.
I'm assuming this is a process. It's not going to be done in a one appointment thing.
Mm-hmm.
Do you get to see like their do you
Oh yeah.
witness their self-confidence
Oh, yeah.
build?
Yeah,
as
that
they
was
that's
that was my next
awesome.
question.
So you
Yeah.
do get to see that. What a reward.
I had the one patient.
That's like a psychiatrist. That's like
Yeah.
what some
Well, it's
people
fun when it does. It impacts people on like a mental health and social level, where it like lifts them out.
and you can see this like as
Oh,
they
yeah.
go through it.
I had one
So
patient
neat.
that showed up with beyond severe periodontal disease. Her teeth were loose and like falling out dramatically.
I hope this isn't my youngest daughter.
No,
Oh gosh, no.
no. But it's a sad case to see it go that way, and it sometimes I give patients a lot of sympathy because to some degree they've never found a dentist that they wanted to work with and get things treated.
Well, what happened with my
Hated seeing the
youngest?
dentist and avoided
Yeah,
the dentist.
they get attached. Or if they don't find the right fit,
Mm-hmm.
and for some reason, dentistry, which maybe you can help me with, seems to have more fear.
There's a lot of dental anxiety.
Yeah, more so than medical, which I'm not quite sure why that is.
It's the pain.
Yeah.
It's
So
not
it's just
comfortable getting the
right
work
there.
done.
It's just right there, and
Sometimes teeth ache. People describe teeth aches being the worst pain they've ever experienced in their life, up there with childbirth
and kidney stones.
and kidney stones and appendicitis.
Oh my God.
Some of the worst pain that
Okay,
humans
so
ever
and
go
it's
through.
because there's so many nerves and right, or what is it?
Teeth are fascinating structures. If
Yeah.
you want to talk more about the nuances of
Just
the
a
anatomy of
tooth,
teeth,
just
it's fascinating.
yeah.
Each tooth is its own organ with a rich blood supply, nerve supply,
Really?
immune function. So and then the teeth are interesting because they have a hard shell of enamel around them, and they don't swell. They don't get larger or smaller.
Oh,
So when you do get a problem with inflammation within a tooth, it doesn't
Can't
expand.
go anywhere.
Can't go anywhere.
Right.
just gonna hurt.
The impact on the nerves.
But how great for you to say
Didn't
right
really
away.
think about that. Yeah.
This is why people are afraid of it. It's the pain. So I'm assuming you have a lot of different avenues to help different patients with different types of, because we all register pain different.
Yep.
So what are a couple different ways other than what we know, like the laughing gas and the Novocaine and all, like what are other ways?
Yep. Yep. You've got the two hallmarks, right?
Mm-hmm.
All the canes, Novocaine, lidocaine, mepivacaine, and then you have laughing gas, the nitrous oxide. And then, of course, in our office, we do all forms of sedation. So you can have pill form, Valium, benzodiazepine type
So
sedation.
to help with that anxiety, and
Put
then
'em
you
to sleep.
monitor that.
Yeah.
Yep. We can put them to sleep
Mm-hmm.
with pill form. Otherwise, we put an IV in and administer IV sedation medications on a minimal, moderate, or deep sedation.
Mm-hmm.
And then we, in our office, do higher level surgery where we need CRNAs, nurse anesthetists,
Mm-hmm.
and or dental anesthesiologists to come in and
So you would
put
do
our patients
wisdom
to
teeth
sleep.
as well, like pulling wisdom teeth, like when they're impacted, and
Yep.
you would.
Oh yeah.
Wow, so you're like the whole thing, because I don't know if it's still this way, but it used to be. It seemed like you had your dentist, but then if you had a wisdom issue, you go to another dentist
Right.
or
Go to a
something.
specialist.
Well,
or
nice.
An oral
So-
surgeon or
It's certainly the case still most of
Oh,
the
is
time.
it okay? So
I
nice
just like
that you
surgery a
have
lot,
that.
so
yeah.
So you have that whole, and surgeons are just, they are a breed of their own.
Oh,
And
yeah.
I appreciate them after having 2 spinal surgeries, but
Yeah.
they are a breed of their own, I've noticed. So
yeah.
maybe that's what I'm picking up on. So you do love surgery.
I do. It is interesting because it challenges your confidence, your ego, if you will.
Mm-hmm.
Because you can't go into, really any type of surgery without knowing what to do, problem solve, and I think that's part of the excitement of it.
Yeah.
And then of course seeing the outcomes, because the outcomes are even more dramatic than.
See, look at you. You're not famous or anything, and look at the extraordinary things you're doing.
Yeah,
This is why we like the ordinary people in the laundry room, isn't it?
No, I
Exactly
love
it.
it.
This is
Exactly it.
amazing, and don't take ordinary as an insult.
Oh, I
Please
take it as a
do
great compliment.
not, because this is just that's what I say. We have ordinary people doing extraordinary things all the time,
Yeah.
Yep.
and we forget to acknowledge that.
Yep.
It is really cool to hear about all the people's lives that you've changed over time. I think that's really, really powerful. I bet that helps you sleep at night, along with the airway
Along with
treatments.
the airway treatment. Yep.
And I also, you do, I think you were just about to tell us a story about a patient of yours that you thought you were changing their lives. Was that an implant patient? Because you do, I read on your website, do a lot of
implant. So I'm assuming that
implant
means
dentistry as well.
it's not dentures. They're
Correct.
because dentures you take out
Implants.
Yep.
and you put in, right?
Oh yeah,
Okay. Are dentures still a thing?
they are. Yep. Especially as the most affordable, simple option for replacing teeth.
Wow.
It's a sad, some people tolerate them pretty well, but a lot of people don't. But yeah, it becomes two big pieces of plastic that can look really nice, but are really tough to function
Sounds
with and chew with.
Chew it,
So
yeah, just to live
uncomfortable.
with, just
Yeah.
to live with.
Yeah.
I don't wish it on anyone, which is why we do so
So
many
you do the
implants in
implant.
practice.
So tell us about that.
Well, this patient, because our dear listeners deserve to hear the rest of the story, this patient showed up with severe periodontal disease, like just massive levels of inflammation and infection present.
Mm-hmm.
So much so that her cheeks were red from all the inflammation.
Oh no.
That's
Where you could
awful.
see it across her whole face, and she looked visibly fatigued, and like it was like challenging on her body.
Draining her.
Well, it sounds like
Yeah.
it's constant pain. Like
Yeah, and then it's constant
the
levels
dull-
of like, inflammation and infection.
yeah, just that. Okay, and
it's-
then that affects your heart, your lung, all your organs.
All the things. Yeah. But yeah, we were able to, a dental anesthesiologist, put her to sleep, full anesthesia, really comfortable for, I think, might have been like a 8.5 hour surgery, where we took out all of her teeth, coordinated. Her treatment was incredible. Coordinated with the IV antibiotics. We administered IV infusion therapy with vitamin C. She actually got an IV ozone therapy, which is called major autohemotherapy.
Is that for oxygen in the blood,
You
or
essentially have because we're taking out all the teeth, that infection and inflammation is being released. It's even more so going throughout the bloodstream and being picked up by the rest of the body. So you really want to do your due diligence of using IV antibiotics to clean all the bacteria out of the blood.
Right.
Oh, okay, that
And
makes
then
sense.
between
okay.
that and everything else, then you're running the ozone and the vitamin C therapy to
It's an extra boost.
be an antioxidant to
Yeah.
clean and cleanse and boost the whole system's metabolism so that the whole body responds well to surgery, not just the mouth. So we paired
And
all
that
of
makes
that.
sense. And how great would that be if all surgeons did that?
It's
Yeah.
definitely
Do they do that when you're like you get a knee replacement? Are they worried about the rest of your body, or are they just focusing on the knee? I mean, I like that.
really, really.
Because it's all connected.
Now it's fun because we're doing it for even just like routine single extractions. Patients have the option of adding it on. So
That's neat.
it's really, really good therapy.
Yeah.
But yeah, for this woman, then we placed 16 zirconia implants, 8 on the top, 8 on the bottom.
Wow.
Rebuilt the bone in a vertical and horizontal manner as best we could to regain some of what was lost. And then I think to my surprise, because just knowing the nature of these surgeries and the probability of implant failure, I was expecting to see 1 or 2, maybe 3 implants fail.
Yeah. Especially with how bad her
Especially
infection
with how
sounded.
bad the infections were.
Yeah.
But you have the beautiful reality of when you clean it all out at the same time in one surgery, especially with ozone and laser, we're disinfecting the whole mouth all at once,
Right.
disinfecting the bloodstream all at once. So a lot of the time from what I've seen, the periodontal disease doesn't come back,
Wow, that's
practically
awesome.
cured.
Yeah.
The gum tissue goes back to bright pink and
Wow.
healthy.
So you got rid of it, and so it was able to start from the beginning.
And then with same day
Nice.
temporaries, with all the sutures and everything, the majority of her bone grafting and PRF took beautifully.
Yeah. Oh, wow.
And we actually regained a lot of that tissue, so much so that now that she's progressing towards finals, you can hardly see.
So because you cleared out all that infection, so the gums and all that have that potential of rejuvenating, regrowing.
This is a great, great point as far as what I discovered on the continuing education circuit and going to different courses. I think what I ultimately found passion in was regenerative medicine,
Okay.
dentistry, and the merge of biological dentistry with regenerative medicine, and the goal of regenerating tissue, regrowing tissue, and bringing the body back to where it should be. But to me, it's one of the hallmarks of the holistic perspective as well, is typically a philosophy of really embracing the natural and what the body's capable of.
Right.
Because the body knows how to heal. If you change the conditions and you provide the opportunity
And
for
you
good
allow
healing,
it to heal. Yeah.
the body heals.
Right.
So
okay.
cool. Oh, wow.
That is great.
I love
to
that.
know that those tissues have that potential, which you have to treat the whole body too.
So much so that it feels like I'm doing some of the hard work, but I always tell the patient, you're doing the hard work to heal this.
Right.
So when they step up and they're on their diet and exercise and supplement game, they're getting their sleep, they're setting themselves up for surgery, they're healing after surgery, people get a better result.
Right.
Well, because, it's not only on you. I mean, the patient has to be the one to take the initial steps and actually commit to treatment and taking care of themselves afterwards. I mean, it's not like a one and done procedure. It sounds like for a lot of these.
And this woman was a perfect example because she was putting in the work to sleep, to follow directions,
Right.
To eat well.
You gave
And
her
then
a
she
team.
went to
You
the
gave her
medical doctor's office to get regular IV infusion treatments.
Oh, wow, yeah.
And she was setting up her whole body to do this and do
for
it well.
success, and you guys put her on that road with your team.
I can hardly believe her pictures too, because it almost doesn't seem like it should be possible.
Yeah. And you probably got to see her confidence just
That was the beautiful part
Immensely.
too.
Yeah,
is
I
She was
bet.
avoiding dinners
Because-
with her friends.
Well, she was miserable.
Oh yeah. And she couldn't chew anything.
Oh, no.
She was to the point where she couldn't really eat anything, beyond soups.
Oh, God.
It had to be extremely soft, sauteed
Oh,
vegetables,
man.
scrambled egg
That's
quality.
great.
And imagine dating in that scene too, how you couldn't gain. I don't know. Oh, that'd be tough.
Yeah. Yeah.
You
But
changed this woman's whole life.
now she's back, and she cracks me up too, because she wears funky glasses, and she's kind of got a 70s retro hippie kind of vibe. I love her. I love her.
That's
so
great.
cool.
No, I mean, kudos to you and your team, and great for you, really, Captain Kev, for having the insight. Like, I need a whole team to do this. We're not just going to look at the mouth.
Yeah. Oh,
And
that's so great.
That's awesome. And that was one of my questions for Monk and Little Al. Like, where would you like to see dentistry in the next 25 or 30 years? Because they're probably not going to want to listen to what Smarge has to say for that long anyway, which I think we covered.
Yeah.
About it just being all in one, like, or
Or at least
working together.
Yeah, at least
Working
speak to
together.
one another a little bit easier, you know?
Yeah.
Yeah.
So that is great.
Yep. That's what and I would think for the young listeners out there, that you just, it's good to care about all of these nuances of the human body between diet and exercise and sleep and breathing. Some of the things are pretty basic and simple that everyone can and should be doing on a regular basis. But then I think what I've been trying to foster is a sense of hope for what's possible and what we can do. Because certainly where we're at as a society is it's
It's a little iffy right now.
a little iffy. It's extremely unhealthy, and that part is to me really unfortunate. And
Because what do you have? I mean, you can have all the money in the world, or you can have the greatest thing, but if you don't have your health, mental health,
Right.
physical health, dental health, if you don't have your health, what do you have?
Yeah.
Yeah.
You can't even enjoy what you have if you don't have your health.
No,
No.
it's 100%. Yeah.
No, and it really
So,
is the foundation.
That's
for,
great.
Foundation for good living.
Yeah.
And
Yeah.
speaking of balance, that brings me to one of my last questions. I don't know how many more you had, Smarge, but
No, I think that was,
I was curious to
learning so much.
you do all this great work for people, you know, and you're obviously the primary dentist there, but you also own the practice like we previously talked about. How do you find that balance between owning a practice and running a practice efficiently and then also doing all of the work for that practice? That sounds kind of like a nightmare.
And you seem pretty well adjusted sitting here. So do you have playtime? Are you playing? I hope
play.
you're playing. Good. You
I
got
play.
playtime.
I play, I dance, I ski.
Yeah, sounds like you have a few other passions that get you through your...
Good music, good coffee. Because just like you said earlier, every day I wake up thinking I deserve the best cup of coffee I can have today. Because
for
life
you.
is short. And
Absolutely.
And I have heard
Let's
you
live
make a
it.
mean cup of coffee.
Yeah, me
Yeah.
too. Like, I can't wait to.
Yeah.
I'm going to
Stop
stop by at some point.
Yeah,
but
me
I need a
too.
cup of
Stop
coffee.
by. Yep,
And I heard you do some woodworking as well.
I do. Yeah, that is also one of my hobbies, a practical hobby.
Yeah.
It's a functional art, I call it. But it also served me well as a form of stress relief to be productive in another sense while I built the office.
Yeah.
So,
Especially
like
managing
carpentry
it.
work? Is that what we're talking? Okay, okay. And that's not easy.
No.
Yeah.
But
Nope.
you liked it. And
Yeah,
I could see why you would like it because you were talking about the structure of a tooth. You know, the
Uh-huh.
yeah, I could see why you would like
Working
that.
with your
Builder type.
hands.
Yep,
and-
yep.
Yep.
But
Yeah.
then you have
Built
the mental
Legos as a
thing.
kid
Yep.
and-
Okay.
Yep.
And
But
so
then
this is your own practice. So you've put your whole heart and soul, literally and figuratively, into this
It's almost start to finish. It's been a fun challenge.
in only 2 years. That's amazing.
Well, 2 years that it's been open.
Okay.
You know, I spent probably I think I added it up at one point. I think it was a full 2 years of planning and execution to get it to its open state.
So
wow.
what made you decide not to rush that? Because 2 years seems like a while, and I could see how somebody would get impatient. And then, I mean, I'm glad you didn't, because it looks like, you know, you put it together. It took you 2 years, and now you're
delays.
delays. That's it. That's it. That's all.
I had issues with. Golly, I mean, I had issues
okay.
with the construction team. I had issues
Okay.
with plumbing. I had issues with electrical. I had issues with
So it
equipment.
wasn't getting your dream together. Like, you had your team together. You knew what you wanted, but then it was the construction
It
part
was.
that
It
helped
was
you.
certainly interesting because, you know, it's just if you were to like build a house, right?
Oh yeah.
You're financing the whole project.
Right.
You're managing the contractor. The contractor is managing the team. You're picking out all the design elements, all the details. You're watching for functionality and flow. for
And
the
keeping
future
track of the
practice.
finances and the
Right.
Yeah.
And then, paying all the bills, keeping track of all the finances. So it's
And then once one thing goes wrong, or maybe not wrong, but just
A little
not
off,
to,
it's
not
just
to
like
the
dominoes.
right timeline, then the rest of it will not
Yeah.
follow that same timeline.
Oh, yeah. Like in its final form, then, like I had a surgery scheduled for June 6th, and I had it scheduled.
Day of opening?
Uh-huh.
Wow.
And I had it. I didn't think. I thought I
Did
was.
anyone say that might be a bad idea?
Yeah, I thought it was going to be.
I'm
open.
just wondering, like I had all this confidence in your team, and now I'm thinking, what part of the
yeah.
team let you say yes?
Oh yeah. The beautiful part about that surgery is I
But
could show
live
you
and learn,
pictures
right?
of it, and it was awesome.
Okay.
The outcome was awesome.
But would you do it again?
I actually would.
Oh,
But
okay.
I'm also a little
That's
bit of
good.
a thrill seeker this
Okay.
way.
Oh, okay.
So I like the challenge and excitement of executing something really complex,
Yeah.
like that surgery. But that surgery was a good example because I thought I would be open for like 4 weeks prior. I thought I'd have all my instruments and equipment fully built out like weeks prior. And then delays in getting the equipment ordering and the instruments in, delays in the fire department coming by to approve it.
Oh,
Because
wow.
some random little detail where they wouldn't approve my final inspection. So I finally got my final inspection from the fire department and my certificate of occupancy from the city of Wheat Ridge on Friday morning and afternoon before a Monday surgery.
No way.
So does the patient know this?
I was going to say.
He knows, he knows some of it.
Did the patient know this? Was the patient like,
You'd like-
okay, doc, okay?
He knows what he's signing up for. You don't
Hopefully
even
he's
have
not-
your
hopefully he's
equipment.
He's not listening. You know
No,
who you are.
He'd be proud of me because he's also, you'd like this, Smart, because he's a fellow small business owner.
Oh,
Oh,
He
yes.
also understands the
I do
challenge
love
of getting
small
this
business.
all ready.
Love to support it.
And then, God bless his heart, he trusted me that I would do what was right by him and get the job done the way it needs to be done.
Nice.
And sure enough, it all came together like it needed to, should, and he got just a phenomenal outcome.
yeah.
Oh, that's great.
awesome. Wow,
That
you
is
were
great.
really. That's too scary for me. You're that's too close to the wire for me, Doc. But
yeah,
you pulled it off. It
Well,
sounds
like I
like.
said, he has a
All
little
with
bit
my
of
own-
thrill seeker, and yeah, you can get it. Yeah,
all with my own finishing touches. All
I
all
know.
that wood in there.
and you
looks
made
really
it
good.
your own.
It does.
That was
It's
the
your
goal.
own.
It does look
Want it to
wonderful
look-
in there. It's really nice. And before we get to 5 on the line, would you like to tell our dear listeners where they might be able to find you?
Well, this beautiful place that we talk about and that I love so dearly is called Reclaim Dentistry.
Mm-hmm.
And you can certainly find us at reclaimdentistry.com. We are officially an Instagram account at
Yeah.
Reclaim Dentistry,
Oh,
though
okay.
I'm still working on some details as far as...
With Instagram, Smarge can help you out with that.
No,
I'm
no,
on it.
I'd
no, no.
appreciate that.
I'm on it.
Maybe I
heard-
can help you with
I heard
that.
Haas is pretty good at...
Yeah.
at
You might
some of
really
this,
want
so
Haas,
I
but
might try to snag her help
Yeah.
for some of this because I'm not a talent as far as social media goes. That's not my forte.
Oh, yeah, I
But-
understand.
I'd
it
be
is, of
happy to
course.
help you, Doc.
But it's just it's a lot to get out to the world, and
Yeah.
I want to make sure it works, it flows, it's functioning, and it's.
I think what you're
doing.
doing is awesome. Like you're treating the whole thing, and we need more of that. I think that is awesome. And thanks so much for. I mean, I'm feeling a little overwhelmed with what you do.
I know.
So
we
it's
might
great
have to
that
have
you can do it. And I'm so glad you got that airway fixed because I think it's giving you a lot of energy, a lot of
does.
clarity.
It does. I can breathe through my nose better.
Yeah, 'cause you're
sleeping
doing a
better.
lot.
enough
Getting
energy to
rested.
run a whole business and
exactly.
be the primary provider there. I mean, that's pretty impressive. So,
It takes a lot of energy. But
Yeah.
yeah.
and then
that's-
do a podcast at
Yeah.
9:30 at night
And-
on a school night.
Yeah, that was cool.
On a school night.
And for now, I have no children right now, so it works out as far as my work-life balance and family goes. But yeah,
Yeah.
it certainly takes a toll when you're working mornings, afternoons, and evenings over and over again.
And weekends and
Yeah, but work hard, play hard, bring some beautiful
Because you
people into your
also
life,
are
and
a
then
Yeah.
doctor.
one day at a
So I
time.
assume when you do surgery, say on a Friday, or maybe you don't do it on a Friday, but who's on call?
he does do it
That's
on
you,
a Friday,
right?
actually.
Oh yeah, I'm on.
So like nobody else is.
Yep.
So it's actually quite a lot. 24/7. We think we get
Yeah.
the surgery and we go home and the doctor's done, but they're still there.
Yeah.
Thank your doctors. Show
Thank your
appreciation.
dentists. Sounds like they
Especially-
work
Well,
their
I
butts
look
They get a
off.
bad
I
reputation.
don't know if you got this yet, but Smarge looks at doctors and dentists as the same thing. Unlike Tooth and Son.
There we go.
I really have always thought doctors and dentists are the same. Like they're doctors. Like that's
Mhm.
how I've looked at it. And I
Yeah.
think more people need to look at it that way.
Changing lives.
Yep.
I love it.
One tooth at a time.
Yep. And for any young dentists listening out there, you know, you can also just do your part, you know. If you understand the big picture and you want to focus in on your segment, you know when to pass people around and refer, like that's
So so
It's a
know
good
your
model.
lane.
That's
Know
what it's
your
all about.
lane.
Yep.
Nice.
Yep.
And with that, it's time for 5 on the line.
Okay.
Doc, who was your favorite childhood pet growing up?
Favorite childhood pet?
This could also be in adulthood, but I believe you don't have a pet right now.
My favorite childhood pet. I'm gonna have to change my security questions for some.
Also, what's your mother's maiden name?
Yeah, right.
Yeah,
Exactly.
we're just curious.
I'll
you
just
know?
say what the pet was, not the name of the pet.
Okay, that's
yeah,
good.
that's
okay.
fine.
But at my parents' lake cabin, growing up in Minnesota, my dad found and rescued a little snapping turtle.
Oh,
And it was so small you could hold it in the palm of your hand. And the little thing, we kept it for weeks. It would like crawl on your like up your shirt.
Yeah.
And it would kind of like tickle your neck.
Like
a snapping turtle?
It was tiny too. It was like the size of like the shell was the size of a $50,
Yeah.
fit in the palm of your hand. Cutest, most adorable little thing. And I've been in love with reptiles ever since.
oh, that's
Oh my
hilarious.
God, that's so funny.
I don't
So
own
did
any
you
reptiles.
return him
gonna
out
say,
to the
Not really.
lake, or
Did you
where
keep
did
it?
he go? Where did he go? Did he go out to the lake, or?
Honestly, I don't know if I want to talk about
Okay.
Oh,
okay.
okay. I understand. Sometimes when you're younger and you find those pets, and then
it. It was
I
one of
get
those
it.
things, you know, you get attached and then your dad gives it away to like a science fair project.
And you're like, what the?
Yeah, exactly.
Did
Well,
you really?
did
I
you
was
not
like, Dad
realize
did
I was
what?
so attached?
And
Oh my gosh.
didn't bother even asking us.
That's funny. My grandfather,
Oh, no.
I'm still obsessed with bunnies, and I love bunnies. I love rabbits. My grandfather gave me 2 rabbits at one point. The minute I had them, they were taken away
Yeah.
because I can remember they did sound like they were barking like dogs. Well, what happened is my grandma asked my grandfather where those bunnies came from, and they came from CSU, from the lab.
No, they didn't.
Yeah, they did.
Really?
Yes.
Wow.
And they were barking like dogs. And my grandma said, "I'm sorry, but that's it. Like, they're not staying here." And I think I had them for 30 minutes.
Oh my God.
Oh goodness.
So things
I don't
can
think
go
I've ever
awry.
heard a
Things can go
bunny
awry.
bark like a dog. That's an interesting one.
I hadn't either,
You could have made millions.
but I thought it was cool. I was like, what,
Yeah.
6? I thought it was awesome.
You have a tiny little dog
But
bunny.
here's another one. So growing up, can you recall your role model, and is it still the same? Has it changed? Or, and I mean, this can be anybody in your life.
Yeah.
You know, might sound corny, but I just have to say my mother.
Oh.
I knew it. I knew. That's why I
I
said
thought
you
you
can
were
say
gonna say
anybody.
that too.
I looked at him with motherly eyes and went, "You can say anybody."
We won't judge you if you say your
Because that's
mother.
awesome.
That's so cute.
But I already heard that. Like, I heard her support earlier when you were talking, and that's awesome.
I alluded to her earlier, but yeah, being a hygienist especially, she was very detail oriented. She clearly was very good at the hand skills and the work of dentistry, as well as the people skills. And she had people, you know, insisting on seeing just her for
Just
27
right.
years.
Oh, wow. 27
I was
years?
just going to say 27 years.
Holy
That's awesome.
So she really set the stage for like,
Yeah.
longevity within dentistry and putting in the effort, giving your all, and then insisting on